All right, welcome back. So let's now continue with our second part of the lecture on 24th chapter, which was the nutrition, metabolism, and energy balance. The learning objective for part 2 is we're going to talk about how are the proteins metabolized in our body. A couple of the reactions we'll be talking about what amino acids go. That's transamination, decarboxylation, or deamination. And then we'll talk about catabolic and anabolic reaction balance in the body. What is absorptive state and post-absorptive state means once the nutrients have been absorbed in our body. And then a little bit about cholesterol metabolism and then the energy balance in our body. So proteins, it's a part of one of the third major macromolecule, which is part of our diet. So when the proteins break down, they break down in our cells continuously. Okay, they get old and they get deformed, and they need to be replaced. So when they break down, they actually break down into amino acids. Okay, so then amino acids can be recycled into either into new proteins or they can be used to generate energy. Remember, we talked about it. If all amino acids are present, then we will synthesize the new proteins. If not, then the amino acids are available to generate energy. Okay, proteins cannot be stored in the body as such, like as fats or as glycogen, etc. So they have to be either oxidized for energy or they must be converted into fat or storage. So when amino acids break down, okay, so the goal is to make something out of that amino acid structure that we can utilize it and enter it into either glycolysis or into one of the keto acid intermediates, which is the citric acid cycle. And there are three different types of reactions amino acids can undergo. One is known as transamination. As the name says, trans means transfer the amine group. Oxidative deamination, or we can also have keto acid modifications. So let's go through this. So in a transamination, the amino acid many amino acids, they transfer their amine group onto their corresponding keto acid. So that second keto acid turns it into an amino acid, and then the first one changes into the keto acid. So remember, I covered it in the lab too, that each amino acid has its corresponding keto acid. Okay, so this reaction is known as transaminase, the forward reaction. Backward reaction can occur too, and that is pyridoxal phosphate enzyme. So here is an example of aspartic acid being changed into oxaloacetic acid, which is a keto acid, the first one present in the Krebs cycle. And there is alpha ketoglutarate, and this can be changed into glutamic acid. Okay, so this reaction is a reversible reaction, and it's the easiest way to convert different amino acids from one form to another. We may also have oxidative deamination. So in the liver, the amine group can be removed as ammonia, and inside the liver, this ammonia is then captured and it is converted into uric acid or urea by combining it with carbon dioxide. So then the urea is then dissolved into water, and that becomes uric acid, and then our kidneys remove the urea or uric acid in the form of urine, and then we just pee it out. Okay, so the example here we're using is glutamate dehydrogenase into alpha ketoglutarate acid plus ammonia. Keto acid modification is there, means all the keto acids which are either generated after the transamination or oxidative deamination reactions, then they can enter into the citric acid cycle, or they can enter into glycolysis. So here's an example of different amino acids. Remember, we have 20 different types of amino acids, and a couple of them are essential. So you don't need to memorize this. This picture is only to show you where each of these amino acids can enter into the two central pathways, which is glycolysis and the TCA cycle or a Krebs cycle. So for example, alanine, glycine, threonine, cysteine, serine, tryptophan, etc., they can enter into pyruvic acid pyruvate and then can convert it to acetyl-CoA, and then from acetyl-CoA to go to acetoacetate, etc. And then it can enter into the citric acid or Krebs cycle. Okay, and hence all of these amino acids can be in this enter into these cycles. Then they can be either used up to generate new glucose, converted into glucose, what we call as gluconeogenesis. Okay, so let's look at here. So in the liver, the transamination reaction occurs. The keto acid is produced plus an amino acid is produced, or you can have oxidative deamination, and the ammonia combines with carbon dioxide. Urea is formed, which is then taken via the blood to the kidney and then excreted as urine. You may also have these keto acids. They are modified and then they go through the blood simple and then go to the cells into the mitochondria and then goes and have the citric acid cycle completed there. Proteins are also synthesized. If all amino acids are present, then the protein synthesis can occur. Okay, so protein synthesis, where does it occur? It occurs on the ribosomes. So this GIF shows you that the mRNA is coming out of the nucleus, and then the two ribosome subunits combine together and read the mRNA and they form the proteins. Okay, so protein synthesis is controlled by many hormones, for example, growth hormones, thyroid hormones, as well as sex hormones. And it will only occur, as I mentioned, if we have a complete set of amino acids. So all the essential amino acids must be present and they must be acquired by the diet. Now let's talk a little bit about what is catabolic anabolic steady state. Remember, we know that the body maintains its homeostasis. Okay, so what is homeostasis? Means maintaining a constant level of things inside the body. So the body is in dynamic state in which all the organic molecules except for your DNA are continuously being formed or broken down. Okay, so the body uses these nutrient pools and stores, which is the amino acid stores, the carbohydrates, the fats, etc. And it can interconvert these pools into one another. Okay, and how much is present at one time will be depending upon the physiological conditions. Okay, and this actually is converted directly by liver and adipose tissue and skeletal muscle. So three tissues actually participate in conversions of these molecules back and forth between the three of them. So the amino acid pool which is present is actually all supply of total free amino acids which are there. Some proteins are lost in your urine, hair also, and skin cells, but they must be replaced by diet. And pool, where is the pool for the proteins or amino acids? Is the resynthesizing body proteins or forming amino acids from other derivatives or from what we call as gluconeogenesis. So the amino acids can be utilized for that purpose too. Let's look at carbohydrate and fat pools. So carbohydrates, what do we have is in our body is glycogen. Okay, so carbohydrates and fats can be very easily interconverted because they have very similar intermediates. So if we have glycogen, we break it down to glucose, and then glucose changes into glucose 6-phosphate or glyceraldehyde 3-phosphate, and then pyruvic acid and acetyl-CoA. So this is, we know, is glycolysis. In fats, we get triglycerides, which goes glycerols and free fatty acids. Free fatty acids change into acetyl-CoA by beta oxidation, and glycerol goes into glyceraldehyde 3-phosphate in as a step between glycolysis. Okay, so it's very easy for them to be interconverted like that. So if we have excess of carbohydrates, then we can convert them into fats. If we have excess of fats and body requires carbohydrates, we can utilize that too. Okay, so they can be converted, but amino acids, we cannot store them as proteins. Proteins must have a function inside the body, and we can't keep accumulating them in the cells. So they are metabolized, and we just learned earlier that proteins can be broken down into amino acids and they can be changed into keto acids. Some of them enter into glycolysis or some of them enter into Krebs cycle. So they can be then converted either into glycogen or into fats. So now let's talk about what is the absorptive state of the body, or what is also known as the fed state of the body. Okay, so this is a stage after you have eaten and after 4 hours of eating. So this is where the absorption of all the nutrients is occurring inside your intestines. Okay, so in this place, your body is more into building a form. So anabolism is actually exceeding the catabolism. So excess nutrients, what you did not need, is going to be now stored as fat if it is not used. Now, if you eat too much, what is not being used, you're going to be putting on weight. Okay. So first thing is the carbohydrates. So carbohydrate, the glucose is the major source for energy. If there is excess of glucose, it's going to be converted into glycogen. If there is an excess of glycerol and fatty acids, they will be converted into triglycerides. And if there are amino acids, a lot of them will synthesize proteins. Okay. So glycogen is formed in the liver, or fat is also formed in the liver. So glycogen will remain inside the liver, but the fat actually is changed into chylomicrons and it's transported through the proteins, and then it is taken into adipose tissue. So it will be transported. So the fat joins the proteins and makes what we call as VLDLs, very low density lipoproteins. And then they're released into the blood and then they go into the adipose tissue. Okay. Glucose, which is in the blood, can enter into cells and generate glycogen in the muscle, as well as they can generate fat into the adipocytes. The triglycerides, which are formed, they are absorbed from the digestive tract as chylomicrons and from the lymph, and then they are hydrolyzed to fatty acids and glycerol before they passes through the capillary walls. And this is typically the lipoprotein lipase is the enzyme which actually hydrolyzes this. This is present a lot in your muscles as well as fat tissue. And then triglycerides can be used by adipocytes, by liver, and the skeletal and the cardiac muscle cells as primary energy source. Most of the glycerol and fatty acids are then converted back into triglycerides for storage. Again, what is going to happen to the amino acids? So some absorbed amino acids can be deaminated by the liver, and they can be changed into keto acids and can be used into citric acid cycle. Excess amino acid will be then stored in the form of fats, triglycerides in the liver. Most of the amino acids which are cells absorb, they can actually use them to synthesize the proteins they require constantly and change them. So here are some of the major events which occurs in the absorptive state. So the intestine, GI tract is where we are absorbing everything. So glucose will go to the tissue and it will be oxidized to produce ATP. Glucose can be converted into glycogen in the muscle. Glucose can also go into the liver and be converted into glycogen. GI amino acids can go to muscles and synthesize more proteins, or they can go to the liver and they can also synthesize proteins, or they can be converted into keto acids and then can be used through the Krebs cycle into carbon dioxide plus water plus ATP. If we have excess of glucose, that can go into the fatty tissue, and you can convert it into fatty acids as well as cholesterol, and then we can store it in adipose tissue. Okay, so if we have excess of triglycerides, they will also be changed into same way. If we have excess of amino acids, they will be then changed into fatty acids too. So there is some control of hormones on the absorptive state. Okay, the major hormone which controls the absorptive state is the insulin and the glucagon. Okay, so insulin is secreted by the beta cells which are present in the islands of Langerhans. So this is the pancreas with the acinus in here, and there's this islets of the Langerhans cells, and there's alpha and beta. So beta cells produce insulin, alpha produces glucagon. Their actions are opposite to one another. Okay, so insulin is secreted as the blood glucose level goes up, or if amino acid levels go up in the blood. So then insulin binds to its receptor, and then it facilitates the removal of glucose or amino acids from the blood into the cells. And that can happen into your muscle cells or as well as your adipose cells. Okay, so insulin decreases the amount of glucose in the blood, so we call it as a hypoglycemic hormone. So it enhances glucose oxidation for energy. It also triggers more glucose goes in glycogen and triglyceride formation. It also enhances the active transportation of the amino acids into the tissue, and also enhances the protein synthesis. And it also inhibits gluconeogenesis, doesn't allow the new glucose to be formed. There are a couple homeostatic imbalances around the blood glucose level, and we have discussed them earlier also in endocrine system too, when we discussed in details about insulin. So one of them is the diabetes mellitus, in which inadequate insulin is produced, or there is an abnormal insulin receptor present. Okay, so this is typically what's going to happen here. So when there is less insulin, or there's an abnormal insulin receptor, the blood glucose level will not go down. The blood will not be able to get rid of its glucose. The glucose is not entering the cells. Okay, so now you will have excessively high glucose levels in the blood. Your body will try to remove it through the urine. So that's gonna have is glucose gonna start coming through the urine. So now the cells are deprived. They can't use glucose. So what are they going to do? They're going to start using fats inside to generate energy, and they can also use proteins to generate energy. So which can actually lead to what? They can lead to metabolic acidosis. And that can also lead to protein wasting. Muscle mass will be lost, and then you'll have a weight loss about that too. Some of the symptoms of diabetes mellitus is excessive thirst, because you have too much solute in your blood, slow healing cuts and sores, you'll have very fatigue is there, blurred vision is there, frequent urination is there, and also you keep gaining and losing the weight. So what happens in the post-absorptive state? So the post-absorptive state is when you haven't eaten and all the absorption has occurred, and this can also be called as fasting state. So in the fasting state, your GI tract is empty, and the energy sources are now supplied by breakdown of whatever reserves we had. So breakdown means catabolism is at its highest now. That means we are catabolizing fats, we are catabolizing glycogen, and we are actually breaking down proteins too, and it's exceeding their anabolism. What's the purpose of all this? The purpose of all this is to maintain the blood glucose level constant between the meals. okay, so that our brain can function. Okay, so this post-absorptive state actually promotes the use of fats and fats for energy. Okay, so we also say glucose sparing, means glucose is spared, so we use fats. So the glucose is saved for the organs that need the most. For example, your brain always uses it. So how do we keep this glucose, blood glucose level constant? Is by taking the glucose from different things. So in our body, glucose can be formed by glycogenolysis. So that's the source of glucose. So glycogenolysis means it's the glycogen is now being broken down. Or we can also have glycogenolysis in skeletal muscles. If muscles are needs glucose too, so they will break it down, and glycogen storage in the muscles will start to break down. We may also have lipolysis in adipose tissue, means now your glycerol can be used for gluconeogenesis in the liver. And then we can also do catabolism of the cellular proteins. So major source, this is the major source for during prolonged fasting, in which proteins are then degraded into the glucose level. Okay. So let's discuss a little bit about glucose sparing, in which we are talking about is the prolonged period of fasting, means you don't eat for a long time. Okay, so in this phase, the glucose body uses more non-carbohydrate sources to convert it into glucose. The brain uses bulk of glucose while others switch to fatty acids as a fuel. Okay, so it does result in ketone body formation. If you haven't taken food for 4 to 5 days, then the brain also starts using the ketone bodies as fuel source. So the major metabolic thirst in the catabolism and replacement of fuels in the blood is the protein will give rise to amino acids, glycogen will give rise to glucose, and triglycerides will give us glycerol and fatty acids. So glucose is then can be utilized to generate ATP. Fatty acids can be utilized, ketones can be utilized, and in the liver, we can use amino acids getting into keto acids, and then from there we generate glucose. And in here, the principal pathway will be then from in the muscle, glycogen will be broken down into glucose, pyruvic acid, and then lactic acid, which will then be shifted to the liver where it will be converted into glucose. Protein will be broken down into the in the muscle to amino acids. Amino acids then in the liver will go to deamination and then turn into keto acids, and then that can be converted into glucose. We may also have from the fatty tissue, adipose tissue, we generate glycerol, which will be changed into glucose, or we generate fatty acids, which can generate ketone bodies and convert it into carbon dioxide. We may also use this fatty acid glycerol into carbon dioxide and water. And the glucose is sent to the brain so that the brain can still work on it. But eventually, if it's for 5 days, then the ketone bodies brain can also use the ketone bodies. So in a post-absorptive state, what is the control systems? So hormone and neural controls are there. So the neural control is the sympathetic nervous system stressed. So sympathetic nervous system actually plays an important role. Okay, so it does work through um, a reduced insulin release. Okay, so the effect is still through the hormones insulin, but it also increases the glucagon levels higher. Okay, so a post-absorptive state will be you reduce the insulin first so that the blood glucose levels uh, drop, and then um, And then glucagon is the hyperglycemic hormone, which is then released so that the blood glucose level will be increased. So glucagon is released when there is blood glucose level going down, and there are amino acids is actually going up, and also glucagon is gonna do what? Glucagon is going to start breaking down glycogens, glycogenolysis, and also start producing gluconeogenesis, means it's going to start synthesizing glucose from non-carbohydrate sources. Okay, it will also cause lipolysis in the adipose tissue, converting the fatty acids into the glycerol. All right, so let's look at this. So when the glucose level have gone down in the blood, because the person has been on fasting for 3 to 4 days, and the body is starting to use the non-carbohydrate sources, so blood glucose level is low, that's going to lower the insulin level, uh, and rising amino acid will stimulate the alpha cells in the pancreatic islets, and then that's going to increase the plasma glucagon, which is going to then stimulate the liver glycogenolysis, break down the glucose, and plasma glucose level goes up. It will also stimulate fatty breakdown, lipolysis in the adipose tissue, and then we have increase in fatty acids, and then they can be utilized to generate glucose. Okay, then the blood glucose level comes back up. So sympathetic nervous system will also innervates the adipose tissue, so that can actually produce the quick access to glucose if the blood glucose level go very low. Okay, so the low plasma glucose levels or any fight or flight response or exercise can trigger this fat mobilization and glycogenolysis. Okay, so this can occur, and this occurs in the sympathetic nervous system. It is occurring at the action of your epinephrine from the adrenal medulla. Other hormones which are involved is your glucagon and insulin. So we already talked about it. Uh, Thyroid hormones, thyroxine can also affect, growth hormone can also affect, sex hormones as well as corticosteroids, glucocorticoids can also affect the metabolism, but their effect is not direct, which we see here through glucagon and the insulin. It is an indirect effect to maintain the blood glucose level. This table actually helps, and it tells you what it does. So it's a summary form of which hormone affects how in the body. For example, insulin stimulates the glucose uptake. It also stimulates the amino acid uptake. It also stimulates glucose catabolism to make more energy. It also stimulates the glycogenesis, and it also stimulates lipogenesis and fat storage. It inhibits the gluconeogenesis, also stimulates protein synthesis, etc. Glucagon is also stimulates glycogenolysis, means uh, it's going to break down the glycogen to upgrade the glucose level. It also stimulates the lipid fat breakdown, so we can generate more glucose. It also stimulates synthesis of new glucose from the amino acids and the fats. Epinephrine does the same thing as that of glucagon. Okay, and growth hormone does the same. Protein synthesis, it's anabolic, and also lipolysis as well as gluconeogenesis. Uh, Thyroxine does the similar thing. Some of them as that of insulin, and some of them as one of them is the lipolysis. And cortisols do exactly um, paras, which is sympathetic system. And then testosterone enhances the protein synthesis. let's look at how does liver function. So liver is the key to the metabolism. So liver is made up of cells which are known as hepatocytes, and approximately they can carry out around 500 different types of metabolic function. So they process almost every class of the nutrients, which is whether it is carbohydrates, it's proteins, lipids, etc. They also play a huge role in plasma cholesterol levels and also store vitamins as well as minerals. They also metabolize a lot of chemicals, alcohol, drugs, also synthesize hormones, and also produce what is known as bilirubin. Okay, so this table actually kind of mentions what exactly the liver does. Okay, uh, one of the most unusual thing is it can store vitamin A up to 1 to 2 years of supply, and also stabilize sizable amounts of vitamin D and B12. Okay, so it's a good table to review before the exam. All right, so let's look at the cholesterol metabolism and the regulation of the blood cholesterol level. Okay, recall that cholesterol is a type of a steroid, and the steroids have these four ring structures in them. So all steroids are having this steroidal nucleus. And also remember, the cholesterol is part of the plasma membrane structure. It is not used as an energy source. It is also part of the bile salts, as well as a precursor for steroid hormones as well as vitamin D. Okay, it it actually stabilizes the plasma membranes, but decreases their permeability. Okay, and the blood cholesterol level typically is very little from the ingested food. 15% of the blood cholesterol is ingested, the rest of it is made. Earlier also we discussed that cholesterol, um, you can actually omit it from the food. You do not have to take it in at all. Your body, your liver cells will make the cholesterol. Okay, and typically it's the liver cells. Okay, whatever extra cholesterol is there, we can actually catabolize it and then actually secrete it in the bile salts, and then those bile salts can be lost in the feces. All right, so now let's look at how is the cholesterol actually transported in our body. So cholesterol is not transported just by itself. It is connected, or it is hooked up to certain proteins. We call them lipoproteins. So lipoproteins are involved in transporting all the lipids, okay, which are water insoluble, plus the fats, etc. And they kind of help these molecules, which are larger triglycerides, etc., to pass through the plasma membrane of the cells. Okay, so the lipoproteins contain, if you look into here, the lipoproteins will contain the surface proteins, and then inside they have the cholesterol here, and then the protein part is there, and then they also have phospholipid bilayers which is surrounding it. Okay, and then the cholesterol is bound into the phospholipid layer. So higher is the amount of lipids present in it, lower will be its density. There are different types of lipoproteins present in our blood. So some of them, we call them as high density lipoproteins. So HDLs. So high density means it is going to be more higher in protein content. Remember, we're going to think about the lipid putting on water. If it floats, it's low density. If it is high density, it's going to sink inside the water. So if you can make that connection, that will be better. So in low density lipoproteins means you have lot of fat, and also you have a lot of cholesterol into it. Then we also have very low density lipoproteins, in which you have more triglycerides are there, and also low density of proteins is there. And then we have chylomicrons, which actually have low density, and but they contain of all triglycerides, and they help them to actually transport the lipids, especially in the digestive tract when the lipids are taken up and they are taken into the inside the lacteals, which is the lymph vessels surrounding the small intestine. Okay, so VLDLs, which is very low density lipoproteins, they will transport triglycerides from the liver to the peripheral tissue, which is the adipose tissue. The LDLs, which is low density lipoproteins, transport cholesterol to the peripheral tissue, and for the membranes, the storage, or anything the cell needs to use it. High density lipoproteins, they transport also the cholesterol from the tissues to the liver, and then can be broken down. Liver can be cholesterol can be used to create bile salts, etc., or any kind of steroid hormone production, etc. Okay, what are other factors which regulate the blood cholesterol level? Okay, so as I mentioned earlier too, your body can produce a lot of cholesterol, and the liver actually produces it regardless of how much dietary cholesterol you take. In reality, we don't even have to take any cholesterol in the diets. Okay, so if you actually cancel all the dietary intake, it will still not affect your cholesterol in the in your blood, because your body is gonna produce it. Okay, couple factors affect the relative amount of the saturated and unsaturated fatty acids in our body. So saturated fatty acids stimulates the liver to synthesize the cholesterol, and they also inhibit the cholesterol excretion from the body. Whereas the unsaturated fatty acids, they enhance the excretion of the cholesterol into the bile salt. This is one reason we say that we should be eating more oil rather than fats, which are triglycerides, or trans fats, which are your margarine or any other thing, hydrogenated oils. Okay, so that's the trans fat. Okay, so the trans fat can occur whenever we have healthy oils and they're chemically transformed into solids. Okay, so that is actually worse, because they actually increases the cholesterol levels, and then they also increases the low density lipoproteins and reduce the high density lipoproteins. Unsaturated fatty acids, for example, in the fish oil, etc., which are the omega-3, they actually have very little amounts of saturated fats and cholesterols, and they actually are very helpful for making also your platelets to be less sticky, and hence help prevent any spontaneous clotting inside your blood vessels, etc. They also have antiarrhythmic effects on the heart, and they can lower our blood pressure too. Stress and cigarette smoking, etc., have been shown to lower the high density proteins, and they also increases the low density lipoproteins. Okay. Aerobic exercises, estrogen increases the high density lipoproteins and decreases the low density lipoproteins. And this is one of the reason for menopausal women, when their estrogen levels go down, their LDLs actually go up. The body shape also plays an important role. Okay, so the apple shape in which the fat is carried in the upper portion of the body, they tend to have more high cholesterol and high low density levels, LDLs, and the pear shape in which the body fat is more onto the hips region or lower region, they will have lower cholesterol and LDL levels. Then what is the total recommended cholesterol or HDL levels or LDL levels? So the maximum total cholesterol should be less than or equal to 200 milligrams per 100 ml of the blood or deciliters. And if there is any higher level, than 200, it has been linked to heart disease, which is arteriosclerosis. Okay, and also we know that the HDLs, they are protective in nature, against the heart disease. So the levels of HDL should be little higher than 60 is good, and below 40 is not good. And the LDL has more cholesterol in it, so they will deposit more cholesterol in the blood vessels. So 100 or less is good, and 130 or above is not good at all. There's clinical homeostatic imbalances are present, which is linked with the levels of cholesterol, HDLs and LDLs, etc., because they can cause cardiovascular disease. Okay, so again, high cholesterol or LDL to HDL ratios, they are used as a predictor for potential disease, but they're only predictors. You cannot for sure say that. Okay, so now they are just using the LDL levels and other risk factors which are more accurate. And how do we treat if we have higher levels of LDLs, etc.? They have been prescriptions of statins. These are cholesterol lowering drugs, and almost more than 10 million Americans actually are put on statin. Let's now talk about what is the energy balance. Okay, so what do we mean by energy balance? The energy balance is the energy released from whatever the food you intook, okay, ingested, and then whatever the energy can be produced. This means energy intake and energy output. Okay, so energy intake is the energy which is liberated during the food oxidation, and energy output includes the energy which is generated, and it almost 60% of it actually is lost as heat. And whatever we can utilize to do some work, or whatever else is left, we store it as a fat or glycogen. Eventually, all the energy which we derive from food is converted into heat, and heat we cannot use in our body to do any work. So what does heat do? Heat is going to warm our tissue, maintain our blood temperature and our body temperature. So indirectly homeostasis, and also allows the metabolic reactions to occur more efficiently. Now let's look at the regulation of food intake and the BMI, what is known as body mass index. Okay, if the energy intake equals to the energy output, then one should have a stable body weight. Okay, if it's not equal, then either you will gain weight or you will lose weight. So BMI is a formula which is used to determine whether a person is obese, or the person is in right weight according relative to their height. So to calculate the BMI, you count the weight in pounds in times 705 divided by height in inches square. Okay, so a person is considered to be overweight if their BMI is between 25 to 30, and he or she is considered to be obese if their BMI is above 30. So obese patients have very high incident of heart disease, which is atherosclerosis, or type 2 diabetes mellitus, hypertension, heart disease, or osteoarthritis too. Okay, so current statistics is 2 out of 3 adults in the United States are overweight, 1 out of 3 is obese, and 1 in 10 has diabetes. 17% of the children are obese actually, and a lot of them will actually become diabetic. What factors control the food intake? Okay, so there are a couple things we're going to be talking about. There's going to be some hormones and some hypothalamic roles too. Okay, and let's look at this. Recall the hypothalamus is present on the lateral sides of the third ventricle of the brain. Okay, so it's towards the anterior ventral region of the brain part. Okay, so this hypothalamus part actually, so we call it, has number of nuclei in it. Okay, so those nuclei release some kind of peptides. So these neurons. So there are three nuclei. One is known as the arcuate nuclei, or ARC. So arcuate nuclei is the most nearest to the central corpus callosum, which divides the hypothalamic region here. So this is the arcuate nucleus. Okay, and then we have the most lateral one, hypothalamic area, and then we have this tiny little ventromedial nuclei present. Okay, so some of the ARC, arcuate nucleus, they release a neuropeptide which is known as NPY. Okay, and they also produce what is known as agouti related peptides, and these peptides, which are from ARC region, enhances the hunger, appetite. Other neurons, they release what we call as pro-opiomelanocortins, POMC, and also known as CART, which is known as cocaine amphetamine regulated transcript. They suppress the appetite. So some of these ARC produce neuropeptide Y, some of them produce POMC, and the others produce CART. So neuropeptide is involved in stimulation of your appetite, whereas POMC and cocaine, the CART, are suppression of the appetite. Okay, so feeding behavior and your hunger is regulated by the neuronal signals, the one we just talked about from hypothalamus. They're also regulated from the neuronal signals from your digestive tract. Now recall, in the digestive tract, what did we had? Okay, so we had number of hormones produced by the neuroendocrine cells too. Apart from that, we also have body also have signal detections based upon what's the body energy storage, what are the other hormones, and also what is the body temperature and other psychological factors. For example, somebody may be stressed or somebody is more calm. So all these things together work together. So you do have thermoreceptors, you have chemoreceptors, etc., and they can actually control our hunger and our food intake. So we can classify these factors into two categories. One is known as short term control systems, and the other one is known as the long term control systems. Okay. All right, so let's discuss what are the short-term regulation of the food intake, which are actually the signals coming from the digestive tract. Okay, so the digestive tract has its own gut brain, and so the neuronal signals can come from there, and that are triggered if we have high protein content in the meal, and also we have more vagal signals, which is your vagus nerves, and also distension when you have eaten up and your digestive tract is distended, and that also will suppress the hunger centers in the central nervous system. So the nutrient signals also are related to the energy stores. For example, your blood glucose level, if it increases, it's gonna depress the eating, and also elevated amino acids and protein levels will also decrease the or depress the eating. So does the fatty acids too. We also know that the enteroendocrine cells in the gut also produce certain hormones. The gut hormone, which is the insulin, and CCK, they can depress the hunger, whereas the glucagon, or GLP, which is glucagon-like protein, actually, and epinephrine, they actually stimulate the hunger. There's another hormone which is produced from the stomach known as ghrelin. So that stimulates the appetite, and the ghrelins level actually peak prior to you eat. So that's the one which actually helps you to figure out that, hey, I'm hungry. Okay, so they can affect and GLP, which is glucagon like protein 1, acts on the hypothalamus region. Okay, and that also helps is the gastric emptying also helps, and the CCK increases the gastric emptying as well as the gut motility. It does that too. Okay, the insulin also or pancreas also affect uh, the blood glucose levels. So let's talk about the long-term regulation of the food intake, and the hormone is the leptin. Okay, so leptin is actually released by fat cells in response to increase in the body fat mass. Okay, so leptin is an indicator of the total energy which is stored inside the fat tissue. Okay, it also protects us against the weight loss, especially when we are in nutrition deprivation mode. Okay, leptin acts on ARC neurons in the hypothalamus. So what it does is it actually suppresses the secretion of NYP, neuropeptide Y, which is an potent appetite stimulant. Okay, it also uh, stimulates the expression of CART, which we just talked about earlier too in the previous slides. Okay, so typically the resting levels of leptin can cause rising levels if you give a little bit more leptin can increase in some weight loss, but it's not a magic bullet for obese patients that it's gonna work very well. Okay. Many obese people have very high level of leptin, but it seems like the leptin is not working. Okay, so so the theory that whether leptin helps to prevent weight loss during the nutrition deprivation can occur. All right, so let's summarize this. In which we talk about the appetite and the food intake and the role of hypothalamus, as well as the short-term controls and long-term controls. Okay, the short-term controls are going to be from originating from the GI tract, and that could be the vagal afferent nerves, which is the parasympathetic part of the vagus nerve, and that could be activated by as the food enters into the GI tract. We may also have nutrient signals, for example, the rising blood glucose level, rising amino acid levels, and fatty acid levels, gut hormones, insulin and CCK, and gut hormones, which is ghrelin, glucagon, and epinephrine, etc. So they work through the brain stem, which is the solitary nucleus, and then in the long term, it's going to be exerted through the hypothalamus. So remember, hypothalamus had POMC and CART neurons, which are going to produce CART um, peptides, which is gonna then act on the ventromedial nucleus, and they're gonna suppress the hunger, which is they actually enhances the satiety. Whereas the ARC nucleus, which is gonna generate the NYP PYs, neuropeptides or ARGP peptides, and they will actually work on the lateral hypothalamic areas when they release the orexins, which and then enhances the appetite. Okay, so what other additional factors play a role in regulation of the food intake? One of them is temperature. Temperature, if it is cold temperature, that's going to activate more hunger centers. And stress also affects, depends upon the individual. For some people, they eat more during the stressful situations. For others, they cannot eat at all. Psychological factors are there. Some viral infections like adenoviruses infections are also there. Sleep deprivation, if you do not have enough sleep, you will actually eat more. And also the composition of the gut bacteria affects that too. Okay. Now let's look at what do we mean by metabolic rate. So the metabolic rate is actually the total heat which is produced by all the chemical reactions and the amount of mechanical work uh, which is done by the body, and we can measure it. We can measure it directly by calorimetric method, or measure the heat liberated into the water chamber, or we can do it directly, which is the respirometer, in which we can see how much oxygen is being consumed, and then we can correlate it to the heat production in the body. Another important topic as we are talking about the energy and the nutrition is what is known as the basal metabolic rate, BMR. So basal metabolic rate reflects the energy the body needs to perform its most essential activities. Okay, and this can be measured in the post absorptive state, 12 hours fasting, and also in reclining position or relaxed mentally and physically, and the room temperature should be between 20 to 25. Okay, you can record it as kilocalories per square meter of the body surface, and for example, for an average 70 kg person, it should be around 66 calories per hour. BMR can be affected by the age and the gender. As we age, it decreases. Males actually have highly disproportionate higher BMR. Body temperature also affects it. BMR increases with the temperature. Stress also increases the BMR. And thyroxine, which is your T3, T4 thyroid hormone, also increases the BMR. So there are a couple homeostatic imbalances which are associated with the BMR. So hyperthyroidism is caused when we have a lot of T3, T4 is produced, and this actually results in certain symptoms. One of the symptoms of hyperthyroidism is bulging eyes, and you may also have goiter too. And this is the body will catabolize all the stored fats and the tissue proteins. So you will have increased hunger and food intake, but the person often keeps losing the weight. They will have weakened bones and they will have weakened muscles, and including the heart, and that everything starts atrophy. Hypothyroidism also is opposite to hyperthyroidism, and this is a slowed metabolism and results in obesity and diminished thought process too. So you may have forgetfulness, etc. The muscle soreness is there, constipation is there, depression can be there, fatigue can be there, the skin is getting drier and drier. So a lot of people get hypothyroidism also as we age. Then another term which is utilized is called total metabolic rate. Okay, so to TMR. So TMR is described as the rate at which the calories are consumed to fuel all the activities which are going on in the body. Okay, so if you increase the muscle activity, and then you also can have food ingestion, so then food can also induce what we call as thermogenesis, means change in the body temperature. Okay, so typically energy is there and metabolism is there, and how do we use this? Okay, so that's the key. Okay, what do we use the energy for? So activity can be used for activity thermogenesis, means when you're actively participating. For example, physical activity utilizes around 20% of our energy. Basal metabolic rate is going to use 70% of the energy, and then thermic effect of the food is around this 10%, means which maintains your body temperature. Okay, so the total metabolic rate is higher when we have ingested more proteins and alcohols. So that brings us, how does the food intake can affect our body temperature? So let's talk about how do body regulates its body temperature. Okay, so the body temperature is the balance between heat production and the heat loss. Okay, when we are at rest, our liver, heart, brain, and kidneys and endocrine organs, they all generate uh, most of the heat. Okay, so during the exercise, the heat is generated by the skeletal muscles and it is drastically increased. So the normal body temperature is around 37 degrees centigrade plus minus 5, and that's the optimum temperature at which the body enzymes can work. If you increase the body temperature, your your proteins in the cells can actually start disintegrating or denaturing, and it can depress the neurons. For example, the children under the age of 5, if they have 106 degree temperature, this can lead to convulsions and even death. If the body temperature goes 109, that can actually cause the death. Okay, tissue tissue can tolerate lower body temperature better than higher body temperature. Okay, so heat production is done by the basal metabolism, the muscular activity, T3, T4, epinephrine, etc. Okay, and also the temperature effect, how much is the outside temperature, and heat loss is typically lost through radiation, conduction, or convection, as well as the evaporation, etc. So our body has a core temperature and also have the shell temperature. So the core is the organs which are within your skull and thoracic cavity and the abdominal cavity. They tend to have higher temperature as compared to your outside or shell temperature. Okay. So the best way to measure your body temperature is the rectal temperature, which is done by the clinic staff, especially in the children. Okay, so the core temperature is regulated and is fairly maintained constantly. Okay, so the blood is the major agent of heat exchange between the external organs and the internal. The shell, which is your skin, can vary. So this can vary from anywhere between 20 degrees to 40 degrees depending upon what is the environment you are standing. What are some of the mechanism how the heat is exchanged? So there are four mechanisms. One is radiation, means the heat is lost as infrared rays. Then conduction is it is transferred directly by contact, and convection is when the transfer of heat is done to the surrounding air. We may also have evaporation, which is the heat loss due to evaporation of water on your skin or body surfaces. We also call it as heat of vaporization. Now our body, we lose a perspiration, or we do heat of vaporization by two ways. So we actually have sweat, what is known as insensible heat loss. This is because the water is lost from the lungs, the oral mucosa, and the skin. It is typically less than 10% of your basal heat production. Then we also have sensible heat loss, which is when the body temperature has risen and you're sweating, especially in your exercise, etc. When you're sweating, that's a sensible. Insensible is when you're not working and then you lose some water or heat is being lost. Now let's look at how all this temperature is regulated. Again, hypothalamus plays a vital role in controlling the body temperature. So we have thermoregulatory centers inside the hypothalamus, and one of the region is the preoptic region that integrates all the senses as well as regulation of the temperature. Okay, so there are two regulatory systems. One is a heat loss center and the other one is the heat promoting center. So the hypothalamus gets information from the receptors on the skins and the peripheral receptors, and then some central thermoreceptors are present for the core body temperature, and then it can initiate whether the body needs to be losing heat or it needs to have heat promoting activities. So heat promoting mechanism is, now, number one is constriction of the peripheral blood vessels in the cutaneous region. in your blood vessels, so decreasing that the constriction of the blood vessels occur. Okay, so that can happen. If you're too much hot, then they will actually expand. Okay, so constriction is regulated by sympathetic nervous system. So when you're stressed out, you probably have noticed that your hands are actually much more colder. If you're cold, then your body will shiver. Okay, so and your body will also increase the metabolic rate. Okay, so through chemical thermogenesis via epinephrine and norepinephrine, etc. Your brown adipose, we have two types of fats. One is brown, other is white. So brown adipose tissue in infants actually regulates or generates more heat than yellow adipose tissue present. It's also increased by thyroxine, which is the thyroid hormone. Some behavior modifications can be done to modify the heat promoting. For example, you can put more clothes on if you're cold. You can also drink hot, fluids. You can also change your postures, hug yourself more across the chest, or you can also increase activity, just jump up and down so that you can be a little bit hot. So a couple homeostatic imbalances. So if you're exposed to cold temperature, a very cold temperature, your blood flow to the skin can be restricted. It's not a problem if it is only for few shorter period of time. Then you may see a little bit redness there, and the prolonged exposure can actually cause damage. So you may have frost bites. So frostbite is typically cold, painful skin at the end and may turn a little bluish or purplish type. And then you may also have a feeling superficial frostbite is when you feel pins and needles and patches of the skin starts peeling off. Then you can also have deep frostbite when there's numbness and it's a hard and black skin has formed because now there was no blood supply to it. And that can cause the tissue to be dead. Heat loss is now heat promoting center is inhibited in here. Okay, so you'll have dilation of the cutaneous blood vessels, so you can actually radiate out the heat. You may have excessive or enhanced sweating so that you can cool down. Another thing you can do is you can volunteer measures can be seeking a cooler environment, fan yourself, wearing light color clothes and loose fitting clothes so you can feel it a little bit more airy and little bit more sweaty. Couple of the homeostatic imbalances around this topic is hyperthermia, that is the increased in body temperature. That can depress the regulatory centers in the hypothalamus. This can be a positive feedback mechanism. Heat stroke is there, which begins at the core of the temperature of core temperature raises to the 41 degrees. So increasing the temperature then causes the increased metabolic rate, which can cause increased body temperature. So that's kind of a dangerous situation then. Skin can become very hot and dry. Organs can be damaged because the blood vessels can be destroyed. Can be fatal if you do not intervene. Heat exhaustion is there too. This is also referred to as exertion-induced heat exhaustion and can result in kind of a collapse after a vigorous exercise, can be due to dehydration or low blood pressure. And you also have heat loss mechanisms are still functioning and may progress to heat stroke if the body is not cooled and rehydrated promptly. Hypothermia can happen too. In hypothermia, the body temperature goes down due to cold exposure. Your vital signs will decrease too. The shivering can stops at the core temperature of 30 to 32 degrees and can progress to coma as well as death, and can have cardiac arrest around 21 degrees centigrades. Okay. So some of the warning signs of hypothermia is confusion, shivering is there, difficulty in speaking, sleepiness, muscle stiffness can occur. Fever is another homeostatic imbalance, and this is typically controlled by the hyperthermia, and this is due to infections. Infection can be bacterial or viral infection, can also be because of cancer or allergies or any central nervous system injuries too. So typically when the white blood cells, typically the macrophages, etc., they are activated, they start releasing pyrogens. Pyrogens are cytokines which can further release what we call as prostaglandins. And the prostaglandins are released from the hypothalamus, and then they reset the body thermostat at higher level. Okay, so this triggers the heat producing mechanism and temperature. Now, fever actually is a body's defense mechanism. Why? Because fever actually promotes uh, liver to produce iron binding proteins. Okay, so that it binds more iron, and bacteria typically needs iron for its growth, so it's kind of a protective measure as long as it is well controlled and maintained. Okay, so natural body defenses, like when you sweat, when your body temperature goes up, your body also sweats a lot. The condition is known as crisis. That can lower the body temperature and opposite to the fever. And antibiotics can also reverse the disease process so that you do not have any more cytokines or pyrogens produced. Okay. So cryogens, which is vasopressin, uh, will reset the thermostat and typically activate the heat loss. The one I was saying, crisis, is the temperature of the body will fall. And in layman's language, we say the fever has broken. What are the developmental aspects of nutrition, metabolism, and energy balances? Okay, so typically, uh, in the first 3 years, if there is any lack of calories or proteins or vitamins uh, of an infant, or in uterus, if there is anything lacking, that will cause really mental deficits and learning disorders. We can also have insulin dependent diabetes mellitus, or genetic or disorders can also result in metabolic problems. Non-insulin dependent diabetes mellitus can occur during middle age and old age, especially in the obese people. Your metabolic rate constantly decreases or declines as we age. Okay. There are many medications for age-related problems which can influence the nutrition. For example, diuretics, which are given for heart failure or hypertension, can increase the risk for hypokalemia, so potassium can go down. Some antibiotics can interfere with the digestion and the absorption by killing the normal microbiota, so they can cause diarrhea. Minerals, laxatives, etc., decreases the absorption of fat-soluble vitamins. Excessive alcohol consumption can affect too, and result in malabsorption. Vitamins and other deficiencies can occur. Other effects we see is if you have too much sugar in your blood, then sugar starts binding to the proteins as we age, which can result in cataracts, clouding of the lenses. Also can become general tissue stiffening. Your skin doesn't become elastic, or actually you start having wrinkles too. Loss of elasticity can occur too. Collagen gets glycosylated. Another homeostatic imbalance is, especially every child is being checked in, is what is known as phenylketonuria. Okay, phenylketonuria is inability to use amino acid called phenylalanine. Okay, so phenylalanine then starts accumulating in the blood, and it can act as a neurotoxin, and then it can cause the brain damage and also retardation. Okay, so most states, the baby newborns are tested for it, and the people who get phenylketonuria, they can actually regulate it by restricting the intake of phenylalanine throughout their lives. They may have more symptoms, includes eczema can be there. They may have a kind of a mosey odor to them, and then seizures can occur if it just keeps progressing and is not detected early. Another one is galactosemia, in which we have a deficiency of enzymes which can convert galactose to glucose, which can then have accumulation of galactose in the blood, which can actually result in the uh, mental deficiencies in the children too. Okay, so galactosemia is the enzymes. Another one is glycogen storage disease, in which the glycogen builds up into the liver and the muscles because the enzymes which help it to convert it to the glucose are lacking. So we cannot use glycogen to generate glucose. That's another homeostatic imbalance. And there are a number of these diseases which are associated with this glycogen storage disease. For example, we have Call's disease, von Guericke's disease, and we also have McArdis disease. And these ones we cannot break down the glycogen into the glucose. The last homeostatic imbalance we're going to talk about is what is known as metabolic syndrome. So the metabolic syndrome actually is a cluster of 5 risk factors. So, and these risk factors actually can double the chance for heart disease and also increases the having diabetes 5 times more. What are those? So these are risk factors is increased waist circumference, okay, and increased blood pressure, increased blood glucose, increased blood triglycerides, and decreased HDLs. Okay, so metabolic syndrome is so it's gonna enhance the double the chance of heart disease and 5 times the chance for being a diabetic patient.